More than 3.8 million confirmed cases of the coronavirus in the United States, 140,000 plus dead. What happened? What went wrong? And will we ever get in front of this? For these questions and more, I'm joined by Dr. Mehmet Oz. He's the cardiothoracic surgeon and host of the Dr. Oz Show. He joins us from New Jersey. All right, doctor, the statistics are amazing, and even the president said it's going up before it goes down. What's going on? What do you make of this?
Well, I think we didn't take the virus as seriously as we should have. And as evidence for that, I'll give you Europe, which had the exact same early insult that we suffered here in the Northeast. You know, I'm in my basement. I've been taping my show here since March because my show's in China, and we all saw how bad it was there. And on the off chance it might come here, we built this. But I never thought I'd be sitting here 5 months later taping shows with you. And the reality is, once we figured out, at least in this part of the country, what a catastrophe this virus could be if you didn't get ahead of it, we actually watched slowly as the country reopened, and witnessed people say, you know what, I've been locked up in my home here in Florida or Texas or Arizona or wherever for months, nothing's happening. I'm going to go out. And now that they've opened up a bar, or I can go hang out with my friends at a rave party, I'll start doing that. Whereas in Europe, the population said, my goodness, we barely got through that. That was close. Now that we're open, because they opened like we opened, we're not going to do foolish things. We're not going to create these mass spreader events where lots of people can get infected all at once from one person who shouldn't be at the party. And for that reason, they've got 10% of the folks infected that we have. Now, there's lots of good news about what's going on with COVID-19 on the science front. We'll get to that. But at its very core, that's what I believe happened, that we got sloppy.
Would you say the leadership, including President Trump, has not been on top of this?
The country itself doesn't like being barked to. I think a lot of times when we get one-stop solutions for everything, and we decide, okay, the entire country is shutting down, you create this sense that we paid our price. And I think of all the things I could focus on, the fact that we didn't have adequate testing back in March, major mistake that many can own. The fact that we shut the entire country down at once, I think we'll look back on and say that was an error, because there are some parts of the country that had not been hard hit. And maybe quarantining, for example, this part of the country selectively would have been wiser. It turns out that as far as we can tell, the infections, especially that are being suffered in Texas and Florida, came primarily from New York. And then I think as we open the country up again, there wasn't a serious enough endeavor to ensure that especially young people realize that the first time around you weren't really at risk because the virus wasn't that much present where you happen to live. But now it's coming for you. So yeah, go to work, yeah, go out, go buy some food, but don't be sloppy in the minute-to-minute decisions you're making. As a good example are masks. I don't understand what the argument is about masks. Masks are about freedom. They're about the freedom for me to go back to school, or for my son to go back to school because he's a senior at Harvard. They just canceled his on-campus classes. And he's a water polo player for the varsity there. That all got canceled because every Ivy League school canceled their fall sports. And I'm sure that's going to happen around the rest of the country, both those actions, canceling of classes and of sports. But what would have prevented that? Maybe a mask would have helped, because masks play a dramatic role in reducing the infectiveness of this virus.
That's what I meant by, did the president lead poorly in this by staying away from masks, saying they were political? Wouldn't you say that was poor leadership?
When you mix politics with medicine, you get politics. And we're seeing that played out in spades. I don't think that any of these issues are political issues. I know why they become political, but as a physician, my job is to tell people the truth best I can. You may not like me for telling you the truth, but that's our charge. And I think a little bit more of that professional mindset will be valuable across the board.
The president says we have the best testing in the world. Do you agree with that?
Well, today we actually do have great testing. Unfortunately, we only started using it aggressively in some of the areas where there was already widespread virus. And I also think that because of the magnitude of cases we have, we aren't able to keep up, certainly with the running of the tests. Even though people can get tested, it can take them 5 days to get a result back, which means for 5 days, you're not sure if that little cough you had is COVID-19 and you need to quarantine, or was it nothing because it got better the next day and you can go back to work. And so people go back to work. And we just have data just this week that the CDC conducted looking at how many people are antibody positive for COVID-19. In other words, they've had the infection. And this data is stunning. They went to 10 geographically diverse U.S. cities, And on average, 10 times more people have had the infection than knew it. 10 times more. And that means that there are a lot of folks who had unreported or undetected cases, which means there was silent transmission. That most of the people who got sick were, without realizing it, infectious, probably going out, spreading it, not appreciating that the lack of a fever, lack of a cough doesn't mean you're safe to go around. And just in case you think, hey, maybe the good news is we'll get close to herd immunity, unfortunately, herd immunity numbers at best are in the 20 to 30% range of the population, and more likely higher than 50%. So we're not even close, because even in the most infected areas, like where I am in New York, we're not close to those numbers yet. You know, New York State's probably 7% of the population has been exposed to the virus already.
Are you surprised to seeing in certain areas babies getting it?
Not surprised babies are getting this virus, and most viruses, children are exposed, and some, especially like Zika, influenza, they tend to be hard hit. This virus tends to spare young children, which is a good experience, I think, for most parents, because we got plenty to worry about without having to worry about your young children. And so the first case in France was reported of a mother who was infected. The baby was delivered by C-section, and the child had COVID-19. Thankfully did well, as did the mother. And my hope is that we'll continue to be blessed by not having young children pay a big price for getting this virus. That benefit tends to wear off by the time you get to the teen years, and certainly into the 20s and 30s.
You've said we're seeing some building block therapies. Let's examine a few. What's dexamethasone?
Dexamethasone is a steroid, and people use steroids. Probably they're comfortable for allergies or for rashes. You get them in skin creams, but when you give it in high doses, you actually slow down and turn off the immune system of the body. Why would you do that? Well, if there's an autoimmune reaction to something, if you're overreacting to an infection, there's collateral damage to your own cells, to your own tissue. You don't want that. So COVID-19, we believe, kills sometimes because of the virus, but more often from the overreaction of the body to the virus. So a lot of people dying don't even have virus in them. They just have an overreacted, inflamed body that's destroying tissue and closing off blood vessels. So dexamethasone, and now we just found out in the last 24 hours, steroids of other types are remarkably effective at blocking that overreaction of the immune system and saving lives. In the United Kingdom and also here in Montefiore, there were large studies done looking at, again, at many patients, and it turns out that you can alter the injuries to the lung caused by inflammation if you give these steroids at the right time. Now, you want to check something called C-reactive protein, or CRP. It's a chemical, a protein produced in the liver that reflects the inflammation in the body. But if it's elevated, giving steroids reduces the risk of having to be on a ventilator, a mechanical breathing tube, or dying by 75%. So the right therapy at the right dose, in the right patient, given at the right time, of course, and all those can be done now that we're getting some data that understands a bit more about the process, can save lives.
What do you make of anti-immune therapies being used successfully in many cancer patients?
Well, it's an interesting reality that the immune system can help you when used appropriately and can hurt you when it's not. So you actually want to use your troops, your immune system, appropriately. And when they're out there attacking tissues that are not supposed to be attacked, the innocent bystanders, so to speak, then you can cause more damage than good. And many illnesses hurt us because our body is creating a civil war in itself, as opposed to being a more targeted way attacking the bad guy. Cancers can do this, so can autoimmune ailments.
All right, what about cannabis?
Cannabis, fascinating opportunity here. It turns out cannabis does sort of reduce that overreaction of the immune system. There may be some direct antiviral benefits of one of the oldest medications we know, which is cannabis. And just recently, there was a study done in mice at the Medical College of Georgia, where they looked at lung injury that they created mimicking COVID-19, and they could slow it down and actually stop it by using CBD. So because it's got a pretty safe profile, there are a lot of scientists interested in trying it out in humans. It's a bit of a way from that early experience in rodents to humans, though. So I wouldn't start taking CBD just in case.
What about interest in inhaled protein called interferon, I guess, beta, tested by 120 plus patients in the United Kingdom successfully.
So interferon is a protein that directs the immune system of where to attack. It's like putting a general in your body and saying, immune system, go attack those bad guys over there, but don't bother these good guys, your lung cells, for example, over here. And when that interferon is present in the right time, it can make sure that the immune system is protecting you appropriately. And that's what this trial seems to hint. Now, it's not published yet, and there's no manuscript, but the researchers were so excited, and it was done at a bunch of centers in the United Kingdom, that they decided to publish the data so that other scientists could begin pursuing it. The nice thing is that we already have interferon. It's already being used clinically. And like some of these other drugs, like the dexamethasone and other steroids, we're repurposing already approved drugs for new indications, which means it's got a safer profile to it.
All right, the top drug makers appeared before Congress, said we might have a vaccine by early next year. What do you think?
Well, I tell you, I'm excited. These companies, they're all large multinational pharmaceutical companies, have partnered up with academic centers. So Oxford's got a partner with AstraZeneca, and Moderna's got a partner, and Pfizer's got a drug, and they're all making different solutions to vaccines. There's two basic kinds. There's the new fangled approaches, primarily mRNA, where they're making a little bit of the RNA of the spike protein of the virus, the part that penetrates into your cells to infect you. And they're getting your body to replicate that little protein so that we can develop an immune reaction to it. So if we ever see a virus come into our body, we can attack it immediately. That's new. It's never been tried before. We've got two major initiatives along those lines, and they both seem to provide lots of encouraging early data where you're having antibodies created and a belief that if the antibody levels are maintained, you'll be protected. The old-fashioned approach is to take a virus that's already weakened, put the elements of the COVID-19 into it, so it's not dangerous, but it's out there, and then your body makes a natural immune response to it. And that data is the compelling data from Oxford, where they gave it to over 1,000 patients, and they have antibody levels that are higher than people who actually got infected with the real COVID-19 virus. Also, very good news, but doesn't predict that it's going to be working long term. They also, by the way, have T cells, killer T cells, that are present in at least 2 months later. Also good news, because killer T cells know who the infected cells are and they'll kill them. So they'll protect you even if the infection is already in your body.